February is Heart Health Month, and research shows that African Americans may have a gene that makes them more susceptible to possibly developing conditions that impact our heart health. Joining us now to discuss the issue is Dr. Keller. Thanks so much for being with us today.
Thank you for having me, Naja. It's a pleasure.
So why are African Americans disproportionately affected by heart disease?
Well, there are a myriad of reasons why this is true. One of the things that the COVID pandemic actually did was expose systemic inadequacies in our healthcare delivery system. And one of the most interesting things that we have found in cardiovascular disease is these inadequacies related to COVID vaccination and testing sites are not just related to COVID. There are structural inadequacies that impact people who have cardiovascular disease as well. I'm a cardiac surgeon, so one of the most important things that I do is take care of people with heart valve disease. We have such fantastic new technology to take care of people with heart valve disease, and people can now have their heart valve replaced using only catheters and a needle stick in their groin, and they can go home the very next day. The technology has made this possible. It's changed the paradigm for taking care of people with heart valve disease. The interesting thing to know is that a black patient and a white patient have the same expectation of a favorable outcome if they have new transcatheter heart valve replacement with the catheters. African American patients, however, are less likely to have this transcatheter treatment, and it also has to do with location and rural areas and poverty-stricken areas, and it is really an inadequacy in the access to care and not necessarily an inadequacy in how they are treated once they do present for this technology. They have the same expectation of doing well if they have the technology, but black patients are less than half as likely to get this technology and more likely to get open heart surgery, which has a mortality risk that's twice as high. So part of what we need to do is try to educate people and expose them to the signs and risk factors for having this kind of heart valve disease so that they can get to someone who can help them.
Wow. So what are the questions, if someone sees this, that they should be asking their doctor?
Well, these symptoms that people have are most commonly associated with having a heart murmur. So if anyone's ever told you that you have a heart murmur, you should certainly be followed up with your doctor just about once a year. And heart murmurs don't necessarily have to be there since you were born. And in fact, aortic stenosis, which is one of the most common forms of heart valve disease, often happens to people as they get older. A lot of times they feel like they're just slowing down and they attribute that to age, but it's not necessarily so. So if you have a heart murmur or know someone who has a heart murmur and they're feeling like they're a little bit more short of breath or can't take care of the things that they used to take care of, definitely have them examined by a cardiologist or a healthcare provider that is well-versed in taking care of people with heart valve disease.
So I want to switch gears now. You co-founded HeartSense. Can you explain what is it and why is it necessary?
HeartSense is a nonprofit organization that is really designed to count people that have been historically uncounted. A lot of the reasons why we have access issues in this country have to do with people having cultural or social nuances that preclude them from being able to present to someone who can take care of them. So things like transportation issues. If someone has to travel an hour or two or even a day to get to a doctor who can take care of something like this that's very technical, then they may not be as able to go and have it taken care of. If someone has child care issues, their kids stay at home now because of the pandemic, they don't have someone to watch their kids, they're not going to go to the doctor. So there are culturally significant nuances and societal nuances having to do with proximity to physicians who have this expertise that are really important. And part of what HeartSense is we try to bring this technology to people in the community, people who would not normally be able to go to the doctor, and give them the confidence to say, yes, it's worth me taking a day off to go to see the doctor because this is going to impact my health in the long term. I'm not going to be able to take care of my family. So we have been gifted technology by several companies in the industry that have artificial intelligence and allow us to be able to reach more people in the community, people that would not necessarily have an occasion to go to the cardiologist or the ability to go to the cardiologist. Really does help for us to be in the community touching people, because it does a lot to dispel these beliefs of hesitancy that have evolved over the years, especially with African American patients in the healthcare community. And it warms your heart to see people actually have confidence in the doctor when we go and touch them.
I can imagine. Well, thank you so much for your amazing life-saving work and for joining us here on BNC Live.